So, it's the Cancer Research UK 100 push-ups a day challenge. Day 29. Day 29, and it's been an interesting month. Anyway, I've got to do these in one session, so I better start. That's the first set. First set of 20. Going to do 5 sets of 20. Not going to drop down to a 10 and finish. I'd like to say thank you to everybody for all the support you've given me throughout the challenge. Tomorrow's the last day. That doesn't mean I'm going away. I won't be doing the challenge anymore. I am going to continue with the press-ups. I'm going to add extra actually, not just the push-ups. I'm going to do some more wider range exercises. Tomorrow I'm going to the gym, 7 o'clock. Thanks for the encouragement. I'm sorry, I don't know how to pronounce your name. Guribal? I don't know. Anyway, here we go. Second set. Things a lot easier for me to pronounce. Thank you. Strange, the thing I'm using says there's nobody watching, but clearly you are. So thank you for your support. So, 40 done, 60 to go. It's interesting doing a challenge like this, because you realise, well, I've realised, I can actually, yeah, I'm stronger than I thought. Yes, you're right, Singh. I am. I don't know if you've seen the first one, and you certainly won't have seen the practice sessions I did before I started. I started about 2 weeks before, and I did 7. That's when I'd already signed up, and that's when I realised that it was going to be a lot harder than I expected. I didn't really think it was going to be easy, but at the same time, I didn't think it'd be so hard. I thought I'd be able to do it and just get on with it and do them in a few sets and off you go, done. But actually, there's been different things causing problems. So, for example, my hand, my left hand, doing it every day is getting no time to recover. My back, when I don't do the push-up properly, I remember day 16, my back was hurting all day, just after the first 50 in the morning. And I was worried about being able to do the rest of them at the end of the day. And I did the rest of them at the end of the day, and my back was still hurting. And I was thinking, well, how am I going to continue and do another 100 tomorrow? But people were watching me, encouraging me. So I did it. And I think that's shown me the benefits of team, benefits of people, benefits of having people that you know support you. So here we go, next 20. It's saying you can go further, help people. My son is saying you can go further, help people, but I don't know if that's I'm assuming that, is that your son's name, I guess? Yeah, I agree. Helping other people, doing it for other people, for me makes a big difference. And interestingly, that the work that I do every day is about helping people. It's all about pharmaceuticals. When I was 14, maybe it was 13, I started working in a pharmacy. It was my dad's pharmacy. Well, he was the manager for the pharmacy for a large company. Large, maybe 15 shops, I think. And yes, I'm a farmer. I watched him helping people every single day. That's what he enjoyed. And we used to see people in the streets. Oh yeah, you're the pharmacist's son. I know your dad. And they used to help him all the time. I'm a pharmaceutical consultant. I help everybody, anybody that asks. So a lot of people tell me I shouldn't. And I do charge, of course. But I help people get whatever they want from their business. Whether that's placing a new product on the market, whether it's supporting preparation for an inspection, getting a new license, site license, fixing problems that have been identified by customers or by regulatory authorities. I do it all. QP, batch release, on-site audits, QMS restructure, resolving deficiencies, managing teams that fix the problems, delivering training, root cause analysis, computer system validation, all sorts. I've been doing it 37 years, so, and I like variety. In my first job, whenever there was something that nobody wanted to do, I used to volunteer. I used to volunteer because I wanted to learn, because I wanted to know more. I'd already been involved in getting the products to the patients. I'd already been involved and seen them with troubles and with success, with thank yous because it worked, and struggling because of this, that, and the other. Dressings. More recently, I helped my wife. She wasn't my wife at the time. She had cancer back in 2010. I helped her get an appointment to see the specialist. She had it removed in 2011, January. And I helped her recover. I helped her I went to the doctors and I told the doctors what dressings were needed for the right drains. They had the drains in, but they didn't know what dressings to use. Not left any part in pharmaceutical cupboard. It's interesting though, don't you think, Singh? I like it. I enjoy it. But you know what I like most of all? Patients getting better. That's the biggest thing. I used to see the, I don't know if you've seen the pictures from the clinics and things. So I used to, we used to have training sessions. We used to have practical sessions where the products that we were making, how they were used. Now, bear in mind, the company that I was working for was Pharmaceutical, medical device, active implantables. We even did synthetic skin. You want to hear about my wife? Okay, my wife. So my wife had chondrocarcinoma. So the ribs on the left-hand side. So there was just like a small, it was about this big. Can you see that? I don't know if you can. Lump on the outside, and it was getting bigger quickly over about 6-7 months. And on the inside, it was about this big. About a small foot, not really a football, child's football, I suppose. And she couldn't get an appointment. I was fortunate that I got made redundant and was put on garden leave. So I had 3 months on garden leave to focus on helping my wife get the appointment she needed. And it was there was 3 different hospitals in the area, and because she had 3 different specialities needed for the treatment, so there was bone, so orthopedic, cardio, the heart, and pulmonary, the lungs. And the growth was encroaching on all 3, so it was coming from the bone and it was encroaching on the lungs and the heart. It was stopping her sleeping at night. And I rang around all the hospitals, and they kept saying, "Oh, it's gone from this one to this one, or this one to this one." Well, I got all the numbers, didn't I? Now, can you give me the number for that? So they gave me the number, and I rang round one after another. Back to this one. Oh, no, they've just sent it to you. So, oh yeah, we've got it here actually. And this is what we're going to do about it now. Then, what are you going to do next? And eventually, we got an appointment in London, guys and St Thomas's, and can you please finish? Okay, my love. And she got the treatment, and that's her telling me that I'm being too loud on the stream. So I'll have to tell you more about it tomorrow. Sorry, Singh. I'll be on about, I guess, about 11 in the morning. I think, I'm not sure yet. And I'll continue to tell you more about it then. But she's now 12 years free from cancer. 12 years after surgical removal. I don't know why. Last 3 hours the hardest. Thank you. Oh. Oh. Yes. We made it successfully. I'm going to have to end now. She wants to go to sleep. I'll see you all tomorrow. Thanks for watching. Yeah. I'm good. I did it. 100 done. See you tomorrow.